Out of the total of 296 schools located in Queens, 20 have been closed as of yesterday. And I believe there's 2 more that are on the bridge of getting closed today. They just closed. I-73 and I-73 and 42 and 203 in Springfield. So another 2 schools have been closed today. There have been 4 confirmed cases at Rikers Island, 1 confirmed death, a local Queens assistant principal, and there has been talk about linkage of a death to a 16-month-old infant, but that has not been verified. Now, school closings affect not only the children, but affect the parents, because the parents then have to stay home or try to find childcare and try to find somehow, some way so that the children can be taken care of. And it doesn't only affect the parents, but then it also affects the employer, because if the parents stay home, then the company doesn't make any money. And the parent doesn't make any money. It's a cycle. So I know that the city of New York, the state of New York, is trying to make sure that we try to get the most possible, the quickest solution to this terrible problem in terms of the swine flu. But I want to read off some statistics so that you understand why is it that we're telling you that you shouldn't panic. New York has 284 confirmed cases across the state. 200 of them have been confirmed in New York City. CDC, the Center for Disease Control, has estimated in comparison there are 553 cases in California. There are 794 cases in Illinois. There are 766 cases in Wisconsin and 556 cases in Texas. So CDC is actually working on these numbers. So in comparison, New York City is very low. But more importantly than that, the Department of Education, the Department of Health are working overtime to make sure that a solution is found, to make sure that factors are determined on why and how they close certain schools. And that's why we're here today to inform you of how the schools are closed, what are the criteria, what are the factors, because it's sometimes complicated. What are some of the symptoms to look out for, how to prevent the flu. That's why some of the doctors are here. And we also joined by some of the elected officials that are going to talk to you about what is it that they have in mind to help on the government front, on the state and on the city level. So I want to